Okay, good morning, everybody. Um, let me use this time to kind of lay out to you how we're gonna go. So we're waiting for the fifth board member. She is walking up now from the parking garage. You'll see from the agenda how it will go. Once we get to the action item, what we're going to do is give everybody 2 minutes of comment. So I'll keep the time here. You'll have 2 minutes. Anybody that wants to speak can. What I ask is proponents go first, and then after all the proponents have gone, then I'll ask for opponents or anybody that wants to neutral. And again, we're gonna keep it to a tight 2 minutes and pretty much go from there. So anybody that wants to say anything will have. Everybody understand? Okay. So she's coming up. Give us a couple of minutes. We'll go from there. Thank you. Okay, so let me make another point. By a question that was asked, somebody was asking about an agenda. We have one here. I don't know if there's one outside, but just note it's not too complicated today. It's just one item. After we have the COVID report, there's just one item, so nobody should worry about getting lost on this thing. I'll keep you abreast of where we are in the agenda, so you know, with the one item. So, just wanted to answer that question because it was posed. Let me say good morning to you all. We'll officially call the meeting to order. Um, I have official notice of meeting, and let me know for the record that there's a copy of the Open Meetings Act here on the north wall of the chambers. With that, we'll have roll call.
Okay, Wilkin. Here. Rogers.
Here.
Wade.
Here.
Gray.
Here.
King. Here.
This is how the agenda will go, so everybody knows. We got 4 items. The second item will be Dr. Poore is going to give us just a general update on coronavirus and talk a little bit about the framework of the proposed mandate. We'll give an opportunity for some public comment for items not on the agenda, and then we'll go into the resolution regarding the mask mandate, and then we'll go from there. So with that, I'll ask Dr. Poore to give us the coronavirus update.
Good morning, Board of Health members, and thank you for having this special meeting today. This has been a difficult time, difficult decision, so I appreciate your input tremendously into this. I'm looking at the data, and I've said from the beginning, it is data that is going to help us make the right decisions. And I want to share with you that as of the week ending 7/25, which was Saturday at midnight, we had 940 cases in our community last week. That compares to 625 the week before and 558 the week before that. On the week of September 4th, of July 4th, we had 521 cases. And at that time, I have to tell you, I felt pretty comfortable. I thought we are seeing our cases decreasing, not till this happened over the last 3 weeks. So you actually can say over the last 3 weeks, we have seen our cases constantly increasing. And potentially last week, they increased 50% from the previous week. So not just 1 or 2 cases. What we have also seen is that our positivity rate has increased, and we were up to 9.6% at the end of this week. That has increased from a low of 7%. And I've always said, I would like the positivity rate to be below 5%. When we look at our race ethnicity, we don't see a lot of changes. When we look at our age ranges, the highest number of cases were in our 20 to 29-year-olds last week. We report 122 deaths in our community, and we report 76 patients with COVID-19 in our hospitals in our community. That is a little bit concerning too, because that has increased by 11 actually since 7/16, just in a week, increased by 11. We also know that hospitals and as hospitalizations as well as death always are a lagging indicator. So why are we here today, and why do we need to make some decisions for our community? At this time, we really cannot say who is infected. We do not know who is asymptomatic or pre-symptomatic. That is really something that we need to keep in mind as we move forward. And the data is clearer day by day. There are lots of evidence out there and lots of studies, but I want to highlight 2 of them that really make it very short. And one is an individual who flew from China to Toronto. And he had respiratory illnesses when he was on the plane. He wore a mask. Contact investigation looked at 25 individuals who were sitting on the plane around this individual, who was positive when he arrived and got tested. None of those 25 got infected. The other thing is a story closer to us. It's actually from Missouri, and it has to do with 2 hairstylists. They have the same regulations as we have in our community, that hairstylists wear masks as well as the clients. Well, one hairstylist had respiratory symptoms, and she was continuing to work. She was continuing to work for 8 days. She was wearing a mask, but when she was off work, she didn't. She infected another of her co-workers who they hung around outside of work and were not wearing masks. So now we had 2 hairstylists with respiratory symptoms in this hair salon. They had to wear masks there. And the investigation looked at 109 different clients that were seen in that salon. None of them was infected, and neither of their households. So it really tells us these are not scientific studies. These are case studies. You know, the virus is new, and a lot of people are saying, well, what do you know about it? We learn about it. And we need to be open to learn and say, this is what we are seeing. This is our new information. So I just want to end what the CDC director said lately. He said, we are not defenseless against COVID. Cloth face covering, one of the most powerful weapons we have to slow and stop the spread of the disease. Particularly, and this is important, particularly when used universally. So over the weekend, I tell you from a professional standpoint, this probably was one of the more difficult weekends. I actually have received more than 100 emails this weekend, just Saturday and Sunday. About 30 of them were against a potential mandate. About 60 of them were in favor, and about 10 of them were neutral. They had questions that they were curious about. But I just want to share with you one of the support that I received from somebody late Friday night, actually, who sent to me a note and said, on behalf of frontline ICU workers who could become overwhelmed, we urge you for a mask mandate. And I received a letter of support from 4 members of the City Council, as well as from the Metro Omaha Medical Society. Omaha teachers, the Nebraska Teachers Union, they all send in letters, and some of them you received at the same time. These were non-solicited letters. We didn't ask them for these letters. Nebraska Furniture Mart senior leadership team sent me a note and said, I hope you are announcing that we are for this mandate. They wanted us all to know how they feel about it. I asked the superintendents, how are they feeling about it? Most of them said, you know, we already are requiring masks when school is going back. So with that in mind, I think I just want to close and say, all Americans have a responsibility to protect themselves, protect their family, and protect their community. Probably a nice note I received from an individual said she was not convinced about masks. And as a matter of fact, she just didn't wear them because she forgot about them till she traveled to Alabama. And Alabama has a mask mandate. So she said, whenever I went out, I had to remember that I needed to wear a mask. And she said, you know, after the second day, it felt very comfortable because it felt like the entire community was working together against this invisible enemy that we have. And she said, and then I came back to Omaha again, and it just didn't feel right. I have heard this from several individuals. I myself have experienced this. So what I'm asking you as Board of Health to really keep that in mind when you are making a decision. I prepared a resolution for you today that actually would provide the health director the authority to get into an order through our city Omaha Charter and regulations from the Douglas County perspective to actually look at a mask mandate. And I think I close with them. Like I said, this is not an easy decision, But you know, if the data would have been different the last 2 weeks, I would have said it's probably not necessary in our community. But the data tells us another story. So with that, any questions you may have? I also have Josh Wolf here from the County Attorney's Office who may be able to answer some of the questions you have in regards to the legal authority that the health director has.
Okay,
Thank
Dr.
you.
Poor. So let me say, I'm going to go to item 3. This is traditional item that's on the agenda. This is a public comment period for things not on the agenda. And if somebody wants to say something about the issue that's not on the agenda, you have a few minutes here. Okay, so with that, we're going to go into item 4, which is the resolution regarding the mask mandate note. I've asked it to be cut to 2 minutes because this is an emergency meeting and we asked to use the room. So I wanted to make sure everybody had their chance to say, and then that we can make the room available because as you can see with social distancing in these times, this is one of the few rooms where you can gather in the building and have spread. So somebody asked me that question. I want to make sure everybody's aware of it. Now, there's a timer that's here. I don't know if this one's running, but there will be one there when you speak. That timer will give you the cues that you know from green, yellow, and red. So with that, what I'd like to do, because I don't think everybody has it, I'm going to read this resolution and ask for a motion and second, and then we'll ask for public debate. And it says, whereas the mission of the Douglas County Health Department is to protect the public's health, and whereas the Board of Health advocates for health measures that are evidence-based, and the ending week of 7/25, Douglas County had 940 COVID-19 cases for the week. This is the highest case count since the week ending 5/30. And whereas this is a 50% increase of the previous week, and whereas the positivity rate has increased from 7.04% to 8.56%, and whereas Director Dr. Robert Redfield of the CDC, as well as other infectious disease professionals, have concluded that the wearing of face coverings over every individual while in public is one of the best methods to slow the spread of COVID-19. And now, therefore, be it resolved by the Douglas County Board of Health that the board is supporting Douglas County Health Director to enter into an order for the City of Omaha and regulations for Douglas County outside of the City of Omaha that require individuals above 5 years old of age to wear face coverings while indoors, unless the individual maintains at least 6 feet separation at all times for anyone who is not there, who is not not of their household. Exceptions will be applied. With that, I'd like to ask for a motion in a second. It's a motion, just a second. Okay, with that, again, I'd like to ask those who are in support to come up first, and then those opposed to come up next. You'll have 2 minutes on the clock. Please just come up and state your name for the record and go from there. Floor is open.
My name is Mike Boyle. I live in the Brandeis Building on 16th Street, and I'll be very brief. This morning, just before I left, I have received a phone call from Mr. Ben Salazar, who's an activist in South Omaha. Ben and Vinny Palermo and Beto Gonzalez have helped distribute nearly 70,000 masks that we've obtained from you. And this morning he called, not knowing I'm coming here, and asked for another 60,000. He said things are getting really tight. The area I represent is the packing houses and the areas where there are a lot of multi-generational families living. This is the right step that you're taking. It is absolutely important that you do this. I congratulate you for taking the action, and I'm so privileged to say how pleased I am with the leadership of Dr. Poor. So with that, I'll conclude my remarks. Let's go get them. We need it.
Anyone else in support? Okay. Again, anyone else? All righty. Those opposed?
Hello, my name is Rihanna Mays. When I was 12, at the first sign of sniffles, or even as a kid at the first sign of sniffles, my father would immediately say, start chugging orange juice. He knew that our immune system had the capability, with some support, to do its God-given job. And 6 months into the pandemic, I've yet to hear a health official state what we could do to increase our immune system's ability to do its job. There's no conversation about vitamin C or zinc or fresh air. It's only cover your faces and survive this episode now. But what happens in the future the next time we have a virus? Last year, Nebraska led the country in flu several weeks in a row, and it was business as usual. Still, no conversation about what you can do to be proactive about your wellness now. I just think that this is going to continue, and I would encourage the conversation to shift to proactive wellness. In a society where we have the opportunity and the choice to buy fast food on every corner, where we have the choice to put wine in our body every day and it's encouraged after a long day, where we still have the choice to smoke cigarettes, I encourage you to change the conversation to what would keep people from being susceptible to this. Obesity is the epidemic. A weak immune system is the epidemic. And the conversation is not supporting what will actually help the people of Douglas County. So with this platform and with your opportunity, I encourage you guys, if you're going to take our constitutional rights away and you're going to mandate anything, mandate behavior that will encourage the health long-term for the people of Omaha. Thank you.
Anyone else?
My name is Phil Beelan. I'm against the mask resolution because it does not state what will eventually lift it. And I have 2 points to make. My first point, like I just said, is it is unwise to introduce a temporary mandate without knowing what will eventually lift it. When you pass a mask mandate, please not only offer specific and measurable variables that require its passage, but also state where those variables need to go in order for the mandate to be withdrawn. Obviously, focusing on just case numbers is inadequate, and an expiration date is not helpful since we know that those have just been extended in the past. We should focus on things that measure severity, like how many hospitalizations caused by COVID and where they need to go, the deaths caused by COVID and where they need to go. I was actually somewhat encouraged by Dr. Poor's report because so many of the cases were in the healthy demographic. I think that's actually encouraging. Outlining specific goals will give Omahans a goal and something specific to aim for, to hope for, and even to pray for. Without a specific goal, it will be harder to galvanize the public who will quickly become fatigued and frustrated. Giving general comments like making sure we head in the right direction or do everything we can are vague and undefined goals that allow you unlimited discretion as to when the mandate could be withdrawn. Again, please do not pass this resolution without telling us specifically what parameters will end it. And my final point, I think it imperative that the mask mandate be accompanied with movement into phase 4 of reopening. If I may be so bold as to give some unsolicited political advice, your mask resolution will be more widely accepted and sustainable if its addition is accompanied by a rollback of other restrictions. For sure, members of the public want to see less restrictions going forward and not more.
Thank you.
Thanks for your time.
Thank you.
My name is Angie McDonald, and I'm against the mask mandate. First of all, I'd like to point out the young lady who was up here before talking about the fact that we haven't heard hardly anything about proactive things that we can do to protect ourselves is spot on. We know that in New York, I believe about half of those deaths were in a nursing home. Of those people, they actually did a study on a sample of those, and all of them were deficient in vitamin D. We know that in the last decade, there's been numerous doctors that have been talking about the importance of vitamin D to increase our immune system. I haven't heard anything. I can't believe this, that we're going to go to these draconian measures of mandate, of taking away our freedom. And so one of the things that we can look at here is today, there's never been a clinical study with randomized control trials in a non-healthcare setting that can vouch for the effectiveness of a universal mask wearing in public. All we have so far are anecdotes. I believe we heard 2 of them this morning. We've heard anecdotal studies of situations where the mask has seemingly been effective. The mask has also been seemingly not necessary in my home. My daughter had coronavirus. It lasted a couple days. She's an adult. She's 19 years old. She's right here. None of us got infected. None of us took even extraordinary measures. But we're healthy. We take our vitamin D. We get outside. We do things to keep ourselves healthy. But there's been no studies. Even Dr. Fauci has said he has no plans to do that. Mask wearing in all the major cities from Los Angeles to Miami has been in place, I believe, since about April. There's been strong community pressure to follow these mandates in those cities. Compliance has been off the charts. Yet the virus is still spreading more than before the mandate. The virus is now spreading in Japan, Hong Kong, and the Philippines, which have near universal mask wearing. So at what point does the mask have to provide evidence of the effectiveness before we continue to mandate these types of unconstitutional mandates? What's the limit? What's the threshold? When will this stop?
That should wrap up, man.
Thank you.
Thank you.
My name is Kay Paulson, and I am opposed to the mandate. And I want to talk about the reduction of the oxygen that one receives while wearing a mask. I'd like to discuss the Altair. It's a sophisticated industrial meter which measures several gases such as oxygen, ammonia, CO2, nitrogen, and more. The meter is spelled, it's ALTAIR, if anybody wanted to know that. Oxygen is measured based on 100%. That's what this meter, how it does it. With normal breathing, when the meter is placed under the nose, it reads 20.8 to 21%. While wearing an N95 mask, the oxygen level dropped to 14%, a 33.3 reduction. This test was administered to my grandson. He also advised me if an area in the plant is under 19% oxygen, they are not allowed to enter. I call on this committee to do further research on the lowered oxygen level while wearing a mask, especially concerning children, before making a decision. Why would a person wear a mask reducing your oxygen by a third? Is it not detrimental to your health? Does this not lower your immune system, as Angie talked about? Without one doubt in my mind, I oppose the wearing of masks.
Thank you. Anyone else?
Hello, my name is Allie French. I just have a few comments to make. I would like to point out that the CDC has set new guidelines that states that the tests that they are doing should not be used to confirm or deny the presence or absence of COVID-19. The fact that we are using these data numbers from tests that are unreliable shouldn't be used to make a mandate. Now, with that said, we also have to keep in mind that people are going to get these tests because they can't get the medical care that they need until they've gotten this test. You're going to get more positives with more tests. It doesn't mean that more people are infected. It doesn't mean that more people are going to fall ill. These tests do not mean that you are COVID-19 positive. You could be positive for any coronavirus at any point in time, as long as you have antibodies present in your body. With that said, I implore you guys to strongly consider the fact that people who want to wear masks will wear masks, but we shouldn't be forcing people who feel confident in their own immune system to wear a mask, especially when we don't have any sound, verifiable science to prove that they are effective. In fact, if we look at, for instance, 3M, who are making many of these masks for us, their boxes even say that they do not protect against coronavirus or any viral infection. So I'd like you guys to keep these things in mind when you decide whether or not to mandate this for people who are healthy and deserve no restrictions on their lives. Thank you.
Anyone else?
Good morning, everyone. Happy Monday. I am Alec Davis. I am a resident of 206 South 19th Street. I am against the mask mandate. I am happy to wear one here. I respect everybody who is and who is exercising their right to not as well. That is mainly the crux of my argument. I believe in personal agency. I believe in our right to make a adult decision based on data, based on personal conviction or morals or religious belief. Most of the time, my preference is to not wear one. If I have a neighbor or a colleague or a friend who is more comfortable with me participating or being around them in that way, I am happy to oblige. I struggle very much with a mandated mask order or again, personal agency, our right to choose. And that's not a phrase I'm always particularly fond of, but just want that to be under consideration. I would also like to point out, or that was mentioned, that the individuals who have been testing positive are in the range of 20 to 29. I'm a 29-year-old male as well, and I would like to think that I am not always the most responsible or thought, I would say conscientious of my neighbor. I love me some me, but at the same time, I care about loving my neighbor as well, and that enters to my equation much of my life as often as it doesn't. So thank you all for hearing me. I just ask for data-driven approach and honesty and well thought for the citizens of this community. Thank you so much. Hope everybody has a great day. Thank you.
Thank you. Anyone else?
Good morning. My name is Dr. Seth Paulson, PhD, Texas A&M. I wanted to comment today just on I wasn't planning to comment on this data, but the data that was presented this morning is actually in contradiction to the data that is published on the Douglas County website. As of last week, July 25th, the official data on the website says there were 27 cases. The week before, 325. The week before, 400. The week before, on July 4th, 428. And that was an increase from the week before, which was 389. This is a drop all the way from May 16th, which was 740. This is a clear representation of a declining rate of cases, not an increasing rate. I don't know where this data is coming from, but it violates what all was said today, violates what is actually published. And I'm calling for an investigation into this data as misrepresentation in this committee today. Moreover, we can see that the death rate, if I may call it such, mortality rate, is 0.13 0.35. That's slightly over 1/8 of 1%. And that's counting total cases. That does not even consider the entire population of Douglas County. In the state of Nebraska, it's 0.122%. Why are we making a mountain out of a molehill? This is ridiculous. I
Thank
rest.
you. Anyone else? I'd ask you not to clap, please.
Hello, my name's Daniel Patterson. I also oppose the mandatory mask mandate. Again, I'd like to echo some of the things that have been previously stated. I believe in personal agency, the ability to choose whether you wear a mask or not. We've seen a lot of businesses, they've decided to mandate masks in their stores, and they have a right to do that. But in a public spaces, I think the person should have that choice. It's also been my experience looking at some of the masks being handed out that they state on the box that they only protect against air pollution and not necessarily viruses or bacteria. So a mandatory mask mandate that just says you need to wear a mask, I think ignores the quality level of the mask, and we need to be looking at that. Looking at Douglas County's health website, is my understanding that we still, that the hospitals are only at 29% capacity, that there's still room in case more people come down with the coronavirus. So I don't think this measure is necessary at this time. Doing my own research, I found a scientific study visualizing the effectiveness of face masks and obstructing respiratory jets by Siddhartha Verma, stated that it depends wildly on personal face masks, on their effectiveness, depending on the material used, and how the mask is worn. So yeah, these are things I would like us to keep in mind as we consider this topic. Thank you very much.
Thank you.
Good morning.
Good
My
morning.
name is Jean Woodard. I don't have any data. I just have a heart because I live in the land of the free and the home of the brave. And I've lived for a long time, as y'all can tell. But I have never seen the amount of fear in this country. Second World War, Vietnam, Korea, in any of those. Never have I seen the amount of fear that I see now. And I am pleading for y'all to think about this and to realize that a mandate is an encroachment upon our freedom. And someone has said that we talked about our personal responsibility. Understand that we as Americans have enough sense, most of us anyway, to wear a mask where we know it's needed and not to wear one. But please don't mandate this. Don't take away our freedoms. Let us be the home of the free, the land of the brave. And that's it. Bless you all.
Thank you. Anyone else? Hold on, Louise, what are you speaking pro or against? You speaking pro or against? Pro. Hold up, you're a little later. I'll let you know, but right now we on cons, against. Stay right there, because eventually you're gonna come.
My name is Andrew Beebe. We're looking at this mandate, and you have to wear a mask if you're going to be close to people, but we've had many instances of people not wearing masks where somebody with a mask comes into their area. How do you actually enforce this? Like somebody steps within there, suddenly, we have got police at every stop, and we're going to try to enforce this law. If you want to encourage people to wear masks, excellent. But if we're going to talk about data-driven things and then give anecdotal evidence for something, I've heard many reports of people getting They go to a test site, they decide not to get tested for whatever reason, and then they get a call a week later saying, hey, you've tested positive for COVID. You know, if we're actually going to talk about data, let's talk about data. Let's not talk about anecdotal evidence. Definitely against this. Let people decide if they want to wear a mask. Let private businesses decide if they want people to wear masks or not. I don't think there's the data that supports mandating this sort of thing. We got, a fairly large number of people testing positive for this, but not a lot of people dying from it. And a lot of those people that have died from it, it's complications of another problem, age or another disease that's taken over, and this just kind of puts the last part in there. So, encourage people. But don't mandate people. You're going to put a lot of people in, possibly in prison for not doing this sort of thing and taking people's monies and fines. I just don't think it's right for our community to do this to each other. Thank you.
Thank you. Anyone else?
May I add a quick comment at the podium? I already spoke, but 20 seconds.
I'll give you. Let me see if anybody else spoke. I'll let you go. Anybody else against?
Hello, my name is Reagan Simons. I'm here today because this mandate that is proposed is an insane demonstration of government overreach by someone who's not even an elected official. According to a document published by the WHO, World Health Organization, June 2020, I would advise you to write this down, advice on the use of masks in context of COVID-19. There are clear risks and harms of wearing a mask long-term, page 8. These are the risks parents are concerned about: difficulty breathing, headaches, skin lesions, self-contamination. I have a 7-year-old. He had to wear a mask. He couldn't keep his hands off it. He's touching everything. He's dropping it on the floor, putting it on his face. It provided no protection to him whatsoever. This document details the filtration of masks in Table 3 on page 9, highlighting wearing a handkerchief or similar only filters about 1% of particles. It makes another point on page 4 that at present there's no direct evidence from studies on COVID-19 and healthy people in the community on the effectiveness of universal masking of healthy people to prevent infection with respiratory viruses, including COVID-19. This is the World Health Organization. There are about 570,000 people in Douglas County, and 105 or so have died with COVID in the last 6 months, so 0.016 of the population. It's important to note, I spoke to this Nebraska state epidemiologist, and he said there are about 50 of the 300 deaths in the entire state of Nebraska that were never even tested for COVID. They are included in the death count because it's likely. Why are we forcing masks that don't work for a pandemic in our area that literally does not exist in our own community? Public health is a local issue according to the law, common sense, and the President of the United States. So we must look at local numbers. With all the information readily available, it's clear the decision to require masks is not being made on science, reason, or the desire to protect citizens of Douglas County. I'm coming in for a landing here. The CDC pneumonia and influenza mortality statistics of 2018 to 2019 shows 320 fatalities as of week 39. This is higher than the current loss in our state due to COVID-19. This means we are well within or less than the normal parameters of a pandemic in our state. So Dr. Poor she pointed out 2 studies, and both of those people in the study were symptomatic. They had high viral loads. You're talking about masking asymptomatic or pre-symptomatic healthy people.
Thank you, ma'am.
Thank you. And so I just want to say that the evidence doesn't support the mask, and this is a clear violation of our constitutional rights. Thank you so much.
Anyone else?
May I have that additional comment?
Yeah, I'll let you know
Okay,
after
got it.
people that haven't gotten their turn. Just-
Hi, my name is Andrea Wyke, and thank you for letting me speak today.
We are 4 months into this epidemic, and have a lot of data such as over 99% of people recover from it. There are 122 deaths in Douglas County, and we all know that that is inflated because even people that aren't tested may be classified as COVID death. This is similar to flu deaths, which mysteriously cannot be found for Nebraska. That data from 2016 to 2018, I wonder why. Bottom line is this is not an emergency. An emergency is imminent threat or a disaster that has just occurred. That means the current emergency state is now unlawful. Where is the emergency? I'll remind you all that you do not have legislative power in the state of Nebraska to create a law. If you pass something today, it is an order guidelines. There is not a law on the books about masks or 6-foot distancing. Otherwise, this is acting in a way to commit a fraud on the public. It is fraudulent act to make the public believe that this will be a law. Fraud is a felony. That is a law. This is not a law. It is not a mandate. It is guidelines. Guidelines that are now unlawful after 4 months into an emergency and after all of the data we have knowing that it has a 99% recovery rate. What is your data to justify this? What are you basing this on? Why are you adamant on perpetuating a fraud on the public? This is unconstitutional and it is not a law. Thank you.
Anyone else that hasn't spoken? Okay. All right. Anyone else that hasn't spoken? Come on.
Hi.
Hello.
My name is Michael Seawick. So this is actually very, very simple. When a foreign body inhabits, attacks the human body, the body fights it. You get a fever, it's fighting it. It's a battle, okay? The human body is fighting this virus, all right? We don't leave, in America, we don't leave people on the battlefield, okay? We don't leave soldiers behind. We don't send people into battle without protective equipment. That's all we're talking about here. We're saying put on a mask to help protect your fellow citizen. That's it. That's it. When we sneeze, when we cough, do we teach our little kids to cover their mouths, or do we just say spray it everywhere? What do we say? Okay, we say cover your mouth. That's all we're asking. We don't send soldiers into battle without the proper gear, okay? And this is a fight. This is a battle, okay? That's all we're asking you to do. Put on a mask to help slow the spread. That's it. It's super simple. And your government will help provide masks to you. What is the argument? What is it exactly? You can't be inconvenienced? This is ridiculous to have this conversation, to have this fight in 2020 in the United States of America. We do not leave people behind. We do not send people into battle without proper equipment. It is that simple. Thank you.
Thank you. Anyone who hasn't spoken?
Hello. I wasn't planning on talking, so I might just ramble. But to that, with little kids sneezing, okay, my kid's 3, knows to take vitamins. We go, and I'm gonna cry because it just makes me so upset. I go to Target, I get the looks, right? I don't have my 2 kids' mask, I don't have me mask. I have a 1-year-old, thank Jesus, has never had a runny nose. He made it through the flu season, he's making it through COVID, okay? My kid looks at all the other kids in the stores. Mom, do they not take vitamins? I mean, son, I don't know, okay? Vitamin C, let's up it. Just like they were saying, we haven't heard one dang thing about taking vitamins or anything. You just want to mask us? What is this? Where do we live? This is America. This makes me so upset. I'm in Office Depot the other day, okay? Don't have masks on all 3 of us again. An older gentleman looks at me and then looks at the lady that's checking us out and says, when can we take these off? Like, you need permission to take your mask off? Does COVID know when it's gonna end? I'm in Target last night. Okay, I shop a lot. I'm in Target last night. And this mom and dad doing school shopping with their 2 kids. They look at me, I'm by myself. Mom, she doesn't have a mask on. And I heard him say, well, she doesn't have to wear one until August 1st. Because COVID knows to hit me August 1st or what? I'm just saying.
Okay, anyone else?
Hi, my name is Jacqueline Fernandez. I'm a registered nurse working with COVID patients directly. I know there's
Jacqueline, you want to bend that mic down to
Yeah.
where
Can you guys hear me now?
Yeah, okay.
My name is Jacqueline Fernandez. I'm a registered nurse working here in Omaha with the COVID patients directly. I just want to offer my personal experience because I've heard a lot of talk about data points, and some people are thinking that our rate of infection is decreasing and that maybe the data points that the health department has provided are not accurate. I just want to offer my personal experience that I've had in the hospital for the past 3 weeks. I've been working at the hospital for 4 years, and I've never seen us so busy, so understaffed, and just not having the resources that we need to take care of these patients. So it's very frustrating when I hear people talking about, the infection rates, the data points that you guys are talking about. I'm working with these patients directly, and I'm seeing what's going on. And we have not, had an influx like this in the entire time that I've been there. So when you hear people say that our capacity in the hospitals for beds is 29%, that doesn't mean we have the staff to actually take care of these patients. Like, nurses don't just appear out of nowhere to take care of these patients that are coming in over the past couple weeks. And that's just my personal experience with it.
Luis, you want to go ahead? Because we're kind of mixing toward the end. Go ahead. Watch the clock. You got 2 minutes there.
2 minutes?
Yep.
Thank you. Luis Jimenez, 3306 Birch Street. Good morning. I came here to the health department to speak about COVID, the virus, and one of the things that has been spoken about is a monetary response to COVID and non-pharmaceutical response to COVID. And this was early on. When the virus came into the United States, we knew that it's going to take a lot of money to respond to this. What wasn't so evident was the non-pharmaceutical things that the public could do to fight the virus. And I very much appreciate Dr. Adipour making it clear for us. And like I said, I came here to talk about health, and now there's people talking about, freedom, choice. The public setting is for the public, and people do not have the right to send vulnerable populations to their graves because it's their personal freedom not to wear a mask. That's not, that does not make sense to me. A public space is for everyone to be in so they can conduct their daily life, businesses in their daily lives. I encourage the board to pass this health measure during a time where there's a resurgence of the virus. And also there is more awareness on how to prevent an infection, how to prevent infection. So I hope you listen to those that are talking about responding to COVID. Thank you.
Thank you. Anyone else? New.
Hi there. My name is Christine, and I was not planning on speaking today. I am a healthcare provider, and I believe in wearing masks when you enter the hospital to protect the patient. I have worked throughout this whole pandemic, and I believe, yeah, you should wear a mask when you go into the hospital to protect patients, and that is the main, priority. When is this going to end? Okay, we have never masked anyone with influenza. We have never masked at all. Due to the data, influenza and pneumonia are higher, okay? Both of my sons have gone to school and they have had influenza A, influenza B, they had pneumonia. I saw them in the hospital. Their oxygen was low. When is this going to end? How am I going to build up my children's immunity of masking them? They are 4 and 6 years old. We right here never have been masked when we were little. I am all about vitamins. I'm all about building immunity. We need to go outside. This is never going to end. I'm sorry, it's not. And yes, I do work in a hospital, and I'm going to tell you, we always are short-staffed. I work in a lab, and I can't tell you, no one has came forward and noticed how we work short-staffed all the time. I have worked in a hospital for 9 years, and I have seen so many patients come in with influenza and pneumonia, and the ICUs are always full. We have 40 people that are always in the ER waiting. I work at a trauma hospital. So to hear how the hospitalizations are actually, not too bad, and I've seen it. We're always busy, and I'm around the COVID testing. But I also am a firm believer of the constitutional rights. I will never mask my children that are 4 and 6. My husband and I are very adamant about that.
Thank you, ma'am.
Thank you.
Anyone else that hasn't spoken? Okay, the couple of people that wanted 10 seconds.
I will try to be very brief. It is my memory over the time when we had the protests and riots that there was a citywide curfew, that many citizens chose to ignore that and made the job of law enforcement a lot more difficult. If this order is put on the books and citizens choose to ignore it, will they be punished? If we're putting laws on the books, I would like to see consistency of judgment in how we treat our citizens, and I do not believe that was demonstrated throughout the protests, and I would like to see that if this is enacted with this rule. Thank you.
Thank you. The other person, okay.
Thank you for the additional comment. When I was a child, I was raped repeatedly by a non-immediate family member. I've been diagnosed PTSD. What I didn't get to say earlier was I don't wear a mask because I am selfish or I want your grandma to die. I wear it because I cannot function in a mask without the PTSD re-triggering. If you don't understand what I'm talking about, thank your lucky stars that you have no idea what it would be like to be confined against your will and have a mask remind you of that. To the people that are talking about mask and wearing mask, I repeatedly saw you touch your mask, which makes it, it's no longer valid. Your nose was hanging out. 2 of you had your noses out. So how can we mandate something where the people that are encouraging it don't even do it right? Finally, a mask is going to lower the immune system of all of the healthy people. Daily, they are exposed to things that their immune system takes on. If you mandate a mask for the healthy people, you are signing their death certificate come flu season because they no longer have the ability to fight, which would have been a 2-day issue. Thank you.
Okay. All right. Ma'am, if you've already spoke.
I know,
so
but we're
I'm
getting 20 seconds
I'm gonna
max
give you
here. All right.
Exactly 20 seconds. Yes,
Right,
ma'am.
20 seconds here. Here's the thing. We have to think about this. 2 of the highest ranking officials here, Dr. Fauci, our Surgeon General, health experts. Just a few months ago, they're telling us you do not need to wear a mask. Folks, you don't need to wear a mask. Today, we don't have any new evidence saying that we need to wear masks. And for some reason, this has changed. Where's the science? Where's the data?
Thank you. This is it. For everybody that spoke, this is it. You got 10
Two
seconds.
sentences. Okay. A decision to violate the Constitution and harm little children to appease grown adults' unfounded fears in a virus that literally has a 99% recovery rate. Dr. Poor mentioned her 60
Thank you,
emails
ma'am.
out of 570,000
ma'am.
people. I represent a group of
Thank you,
1,000
ma'am.
parents.
You got it all
1,000
in.
parents.
You got it all, and I gave you 30
Thank you,
seconds
thank
over
you.
when you up. Okay. Yes, ma'am. So with that, okay, I got some comments, but I'm gonna turn it over to some other board members first who may have some comments.
Well, I just have a couple of questions, and I have some comments too. And since you were first, I'll let you make your comments first.
I'm gonna make a few, and then I'm gonna just set the tone with this. And I just want to address a few comments made by some people. First, I want to say that I have enormous and just an absolute trust in the data that we're putting out. You know, going for the data shot is a kind of a effort that, you know, I don't think stands up. You know, I think we can easily get flu statistics that were here from 2016 to 18. But let me mention one thing on your constitutional rights. I'm all for individual freedom. And your individual freedom is good as long as your individual freedom doesn't hurt me. The exact point of your individual freedom is you have a right to free speech. Classic law school example. You have a right to free speech. You are not going to yell fire in a crowded theater. Because by you having a right to free speech and you yelling fire in a crowded theater, you put everybody else at risk. So let's talk about persuasion and encouragement. Last 2 months, we've been encouraging, persuading, cajoling, begging, and nobody's put a mask on yet. Previously, we had a situation here where in the peak of COVID, we asked people, please don't attend parks. We asked them, don't go to the park, don't crowd up. The only way we could hold it off to prevent the spread was to limit capacity for parks for a while. Curfew. Let's talk about the recent curfew issue. You have a right to free speech, you have a right to assemble, you have a right to protest. We encourage people to protest a certain way, not to do certain things, but when there's a certain point, then we had to put boundaries around it. This is not, you know, an unusual thing in that manner. Question was made about what the number is. Ideally, the number that we should be at from discussions I've had is 20 to 30 a day. We are far away from that. Far away from that. Far away from that. Now, on the first of, you know, before and if I have to say something else, you know, I respect all of this to some degree, but I think, you know, history has proven that I think officials that are on the wrong side of these things regret them. We got lucky on March 18th because school was not in effect. And we were able to shut things down and make things a little whole. The question is, did we kind of open things up a little early? You want your freedoms back, you need to take the inconvenience of a mask. Now, I hear you saying you may not want to worry, but masks being draconian? Come on. Draconian? If somebody stretched us out and making us hang, draconian to put a mask on? The inconvenience is only for a couple of seconds, depending on where you're at, or a couple of minutes if you have to wear them in certain spaces. I think the approach that we're going to go is going to be very tailored. And the period of time is, you know, comments were made about the mask piece at the beginning. I think Dr. Fauci made the statement that, yeah, they made some comments about masks and they made them not knowing fully to some degree because this thing is ever evolving. And quite frankly, they made the comments about masks because we didn't have enough PPE. Absolutely didn't have enough PPE at the beginning. So I just wanted to acknowledge those points and note that nobody's going into this light. For 2 months, we've asked to wear a mask. 2 months, we asked to wear a mask. You know, just saying as one of the bodies that are responsible to some degree. And just to use comparison, I mean, how long do you tell your child don't touch that before you put a boundary on it. And I'm not trying to compare anybody so much to a child. But I mean, there's just a certain point in all of society. How long do you do that before when you know certain actions will be detrimental? You know, the mask process is not about me. It's about you protecting me and me protecting you. So that's the first stage of what I have to say on this. Let me say that, you know, the fact that you're talking about your individual freedoms, I respect that wholeheartedly. That's why we're here today, to make sure you have your part. But, you know, the point I just want to make is, you know, I understand the concern. You can say your piece, but the wearing of a mask, I hope, should not be that dramatic where we got to call it draconian. Mr. Gray.
Thank you. Thank you, Mr. Chairman. First of all, Dr. Poore, if you would please, I just wanted to maybe ask you a couple of questions and then make a couple of comments if you don't mind. Or let me do this. Normally, under city council settings, we hear the proponents, opponents, and then we give you a right to rebuttal. I want to give you the opportunity to rebut, or at least address some of the comments that you've heard today. More specifically, what I'd like to hear from you is the so-called level of oxygen that is depleted or allegedly depleted if you wear a mask, and then any other items that you might want to mention that you heard from some of the opponents, if you want to address those. But I did want you to address that specifically.
So say that again.
The area where he talked, where one of the experts, I guess, got up and said something to the effect that when you wear a mask, you lose about 14 or 16% of your oxygen, or something like that. I just want to make sure. I just want you to respond to that specifically. But any other items that you heard during the opponents section of that you thought you might want to correct, or at least give some text to.
Okay, so in regards to the oxygen question, you know, I just need to share with you, there are always, you have individuals or researchers even who are on both sides of the fence. You always have extremes. But what we in science learned a long time ago, that you really are going to go with what science can repeat over and over, because that is science. And that's really how everything that is being reported and published, it has to be by scientific method. So I'm not sure what the individual was talking about. I haven't seen that study, so it would be difficult for me to comment. However,
well, I guess because I guess what I'm thinking is that I know of surgeons that wear these masks for like 18 hours, you know, when they're doing surgery and other things. And it would seem like to me, if the logic that they're using is comparative, then it would seem to me that surgeons can't operate as long as some of them do.
I have also heard in that presentation, she mentioned the name N95s. N95s are fitted masks that individuals in healthcare that are doing surgery on individuals are wearing. These are not N95s. We are talking about face coverings. And so I'm wondering, like you, if that science is really pertinent to surgeons who wear N95s, or some, not only surgeons who wear N95s all the time. So that's one thing. But what affected me the most was the individual who was trying to make assumptions or statements that our data isn't correct. And I was sitting there, and actually one of my staff sent me a list, sent me immediately what is on our dashboard, douglascountyhealth.com. And on that dashboard, it is very clear. So I am not sure where that information is coming from. But you know, one of the things I just want to make sure, one of the things I'm very specific about is data. especially if I'm declaring I'm making decisions based on data. I double check and I ask staff over and over, share with me, are you sure? Is this data correct? Or if I see some discrepancy. So I took that really to heart, and it is not reflected what is on our website. So we have a dashboard really for the entire public. I want you to know, probably one of the best dashboards where we really try to be transparent, race and ethnicity, and all the numbers. Now, there is sometimes some variation in some numbers, and believe me, if there is, I hear it the next day. And the difference is, for example, by midnight that night, we got reports from the laboratory sent to us directly of the numbers. These are not numbers that we make up. These are clear provided laboratories that need to send their data to the state and then send it to us. But when those data are looked at and when the contact investigation start, often we say, oh my, this is a Sarpy County resident. This is not a Douglas County resident. So then that individual goes over to Sarpy County. So you may see variation. The other thing is often people say, you know, somebody could test several times. Every single person is only positive for one time. There is an individual in our community that has tested 17 times positive. They are counted as one individual. So those are all the things that we are going through. We have 3 data analysts who that's all what they are doing. They are familiar, they are epi-trained, they know what to look at for the data. So that was really the comment I did want to respond to. That really was a little bit more personal than I would have had expected.
Thank you, Doctor. I just wanted to make a couple of comments here. First of all, I believe in I believe in alternatives to and addressing the immune system. You know, I can say to you all that I probably take as many vitamins as anybody in this room, work out as much as anybody in this room, and can tell you that I know that all of those have a benefit. But let me tell you a little bit, because we have been talking about the concern about Black Lives Matter and other issues related here. The people that I represent, and those of you who do take vitamins, you have to know how much they cost. And because I know how much they cost, because I take them every day. We have people in my district primarily who barely can get food, barely can get food. So the idea or the thought that there are going to be some sort of method for them to increase or think about their immune system is the last thing that's on their mind right now, because of redlining, because of other issues that affected us from outside. Right now, we have problems inside with lead and a number of other things. So, you know, the people that we're talking about, I mean, and the people we're talking about, especially in my district, I have a number of people who don't have the ability to purchase or to even think about anything that relates to their immune system, because they're just trying to live from day to day. And with this virus and other things right now, it is going to be even more difficult as those jobs begin to dry up. So to assume that somehow we're going to be able to address this by addressing our immune system, if things were level, then I could see your point to a certain extent, but it's not level. Secondly, doctors and nurses have a right to be protected as well. Teachers have a right to be protected. Those who work in bakers and other grocery stores have a right to be protected. It's not just you all's rights that are involved here. There are those in our community who do the menial jobs every day, who are barely scraping by, and they deserve our protection. I intend to support this, and I intend to support it, quite frankly, and I understand what people say about enforcement and all of those other things, but if we don't address what we see right now going on in a more cohesive way, then we are going to be the next Florida or the next Texas or the next Arizona or the next whatever. You can sit there and say that it's not going to be that way if you want to. The fact of the matter, the data points out something different. So I do intend to support this, and I do intend to support those who are on the front lines every day fighting this thing, or who are on the front lines every day serving this community. They deserve, like everyone else, to be protected. And I would challenge anybody to tell me where the unconstitutionality of this is, especially when it is prescribed for in the city charter, the state law, and federal law as well. Thank you, Mr. Chairman.
Dr. King, then Mr. Wade.
On? Oh, there it is. Okay, thank you. So I heard a lot as well, and I agree with the president as well as Mr. Ben Gray about a lot that what was said. I do want to stress that, you know, what we know about COVID has evolved daily, and so we can't assume that what we hear 3 months ago is always going to apply to today. This is new for us and everybody in the country, so we're doing our best to address it the way that is at the best interest of everyone and not just a few. Also, I heard a lot from the comments today of stopping the virus with this mask. That is not what I've been hearing in terms of what has been said about these masks, is to slow the spread. So we have to be clear about what we're asking or attempting to think about mandating, because we know it's not going to stop it, but we're trying to slow it. I also agree with what Mr. Ben Gray said about not becoming California and New York. The idea is that we want to get ahead of the curve, and we want to make sure that we don't turn into that. And that's really important, especially where we are now. So I do commend you, Dr. Ford, for what you have attempted to do here in our county to keep us safe. And then I just had a question for you also, Dr. Ford. What's the frequency of when the dashboard is updated so that people can be very clear about the data and when it is, if it's in real time or not?
So the question is about when the dashboard is being updated. The dashboard is usually being updated by noon the next day. So, but it is a little bit misleading in regards to the weeks ending 7/25, for example, it is now. So you saw, even so the bottom it says it's the week ending 7/25. The data is accumulated on there, but the end of the week is really the total that we are of. So we may take that point off, so to say, but it also gives you an indication of where we are going. And the dashboard has a lot of numbers by day, so you can actually look. Now, I do want to caution, by day, it is what the laboratory reporting comes into us. So sometimes, for example, there may be a laboratory who isn't working on Sunday. So then on Monday, we get higher numbers in that day. So I really like to look at 7-day rolling averages or the end of a whole week. That's what I presented today. That's what we are seeing. The third week increases as we go along. And so to your question, we always try to, and they are not working SaturdaySunday.com. So unfortunately, over the weekend, it isn't going to be updated. Thank you. That's all.
Mr. Wade.
Thank you. I just want to also throw in that I appreciate the emotionalness of everybody's opinion. I do realize that this is a very polarizing topic. I listened to a lot of the comments from individuals, the proponents and opponents. One of the things that I did hear over and over was about the mask not being effective, or stats about the mask not being effective in preventing COVID. And what I think sometimes people get confused about is the purpose of a mask mandate or wearing a mask is not as much for protecting you, it's about protecting everybody else in the community from you. And I think those stats where they're talking about it, masks not being effective, they're not referring to protecting others from you when you don't know or are asymptomatic and possibly having the virus. The one individual that mentioned the end date, I understand the concern on that, but yeah, I think we just have to trust, like with our directed health mandates when they shut down businesses and put limits on gatherings. They didn't have an end date on those, but yet they when they felt it was to a good point that they could roll that back, and I feel that I'm comfortable that would happen as well. And I can't read my writing on this last one, so I'll just pass on that. All right, thank you.
Okay. Just lastly, before we take the vote, let me just note a couple of more comments that were made. Let's say the data point of hospital rates. By the time your hospital rates get to a point of crisis, it's way too late. You're out of there. So hospital rates, to me, is a straw man because that's not going to be affected until you're totally out of control. There's a whole set of data you need to look at before you get there. Another point that was made, there was implications to herd immunity and masks not letting you get herd immunity. Well, you have a vaccine for the flu. That's fact. That's science. You have a vaccine for the flu. You don't have a vaccine for this. And depending on the sentiment of the public, that you might have the anti-vaccination people, they may not take it. And lastly, the point is just made that you don't know that you have it. And unless somebody can tell me that they are 100% that they don't have it, I'm lost on the argument, particularly when Mr. Wade said, and it's been reiterated, that it's to protect the other people. So unless you can tell me with complete authority that you don't have it, this is one of many measures. It's not the only one, and like Dr. King said, it's not to stop it, but it's to slow it, and it needs to be combined with social distancing and the other elements. So in closing, I definitely want to thank you all out for coming your time. Your opinion is respected. We may not agree, but your opinion is respected. With that, roll call.
Are we completing the vote?
Yes, there's a motion and a second already on the floor.
Yeah. King? Yes. Gray?
Yes.
Rogers?
Yes.
Wilkin? Yes. Wade?
Yes.
The resolution passes. With that, there are no committee reports. Is there a motion to adjourn?
So moved.
There's a second. Roll call.
Okay, Wade?
Yes.
King? Yes. Gray?
Yes.
Wilkin? Yes. Rogers?
Yes. Thank you all for coming out.